Clear Voices of Hope is a powerful collection of voices from For the Love of Cups, Clear Pathways program, dedicated to raising awareness about the realities of dense breast tissue and breast cancer. Through honest conversations and personal stories, we amplify the voices of women who have faced these challenges firsthand, sharing their journeys, fears, triumphs, and lessons learned along the way. Each episode brings you closer to the lived experiences of survivors, advocates, and caregivers, while also featuring leading experts in breast health and women's health. Together, we break down the barriers, provide vital education, and empower listeners to make informed decisions about their own breast health. Whether you're navigating your own diagnosis, supporting a loved one, or passionate about women's health equity, Clear Voices of Hope is your source for real stories, reliable information, and a supportive community. Join us as we shine a light on the path to early detection, better care, and hope for every woman. Welcome back to Clear Voices of Hope. I'm here today with Nancie Steinberg. I'm honored to have her here today, and I'll tell you why. She's got a really incredible survivor story, and she is a woman that has had breast cancer not once but twice and a family history of breast cancer, and has recently made that transition while she is still an active patient into advocacy. And I always consider it a great privilege when a woman wants to share her story with me and have that be shared publicly, because I know it's a big transition to make, not just from survivor to advocate, but also being able to share your story in a public way. And it's not always easy, especially if it's something that's new to you. And so I'm excited to talk a little bit more about that with Nancie, as well as her wealth of experience and knowledge and what she's learned along the way to share with you. But I also want to explore that transition and that part of her story, because I think it's really special. And I think it goes a long way, whether you're somebody who thinks about sharing your story publicly or not, but the way that that can really impact other people that you are just sharing within your community, knowing that your story and your experience matters, and it has the ability to really transform and help other people navigate for their better health. So I'm going to give her a moment to introduce herself. Nancie, welcome to Clear Voices of Hope. Thank you for being here.
Thank you for having me, Lisa. Yeah, great to be here. I live in New York City. I work in healthcare communications, specializing in biotech, pharma, hospitals, and healthcare companies. I've worked almost across every disease state, which includes a lot of emphasis on oncology, as it happens. I was diagnosed 26 years ago with breast cancer, and I received chemotherapy. I had a mastectomy, reconstruction. Back then it was called tram flap. Now it's called deep flap, I guess, and was on chemotherapy, the standard of care at the time. And then I went on tamoxifen for 5 years. And fast forward, I went through genetic testing and was not BRCA1, BRCA2. I was not a BART genetic marker carrier, but my oncologist believed, due to strong family history, because sadly my mom had just passed from metastatic breast cancer right before I was diagnosed 26 years ago. So long story short, I had this further genetic panel testing that became available in the course of 20 years. And sure enough, I possess two genetic markers. One's called CHEK2 and one called, I always mispronounce, DRIP, which has led me to have an oophorectomy a couple of years ago to remove my ovaries, because that was one of the genetic marker indicators. And separately from breast cancer, because I like to keep things interesting, I guess, 14 years ago, I was diagnosed from a routine physical exam blood test. I was feeling great. Got a phone call on a Saturday morning on a soccer field that my white blood cell count was elevated and I needed to go see a hematologist as soon as possible. And I was diagnosed with CML, chronic myeloid leukemia, which I'm living well I'm living well with. I take an oral chemo every day, and thank goodness, because of modern medicine and medications that are available, it's, for me, luckily, pretty much a chronic condition, meaning I'm monitored closely. I'm on the oral chemo, but several years ago, before these drugs were discovered, it was a fatal disease. So I am grateful to the medical community and researchers for that.
Mm-hmm. Yeah, that is amazing. Really incredible that you're here and that you are contributing in this way, and even finding some gratitude in that process. And you're right, things change sometimes very rapidly in what's available as far as treatments go. So amazing that that is something that became an option for you. Um, as well as, the information you got with your genetic testing, which I think is really important to understand, that even though we've had genetic testing, I know I had mine originally done over 10 years ago, that things change, that you
Totally.
need to go back and get it done again. And I think we have something similar there, in which our geneticist told me and my family, with your history, there's definitely something there. We just don't know how to test for it yet. So come back.
Right.
And I think that's what happened with you, was you came back and they were able to find something and give you some really good advice based on that new information.
And what's also interesting is that, which I left off, but 3 months ago, I was diagnosed with DCIS, ductal carcinoma in situ, in my other breast, and I wound up having a mastectomy. They invited me in to meet a genetic counselor because they didn't take more blood, but there were updates on the science behind the markers, and some things had changed in terms of not me physically, but the way the interpretation was done. So you may not even need to have more blood drawn. They could tell you more having your blood already in their
Mm.
coffers, I guess. So that's sort of interesting too. I was very surprised when they asked me to come in. I was like, well, I don't understand if this is zero cancer, and I know it could develop into cancer, but I'm having a mastectomy. Why would I need? And they said, well, there's new things, there's new information. So, yeah.
Yeah, which also may affect treatment and the options that are in front of you, which I think are critical to, if early as you can get that information, the better. So I wanted to back up just a little bit and find out what happened between your first diagnosis of breast cancer and your second diagnosis, and how many years were in between that, and what led you to discovering that you had it in your other breast.
So, as you can imagine, once you've been diagnosed with breast cancer, you are monitored very closely. I was seeing my breast surgeon and my breast oncologist. Initially, I don't know how often, but eventually it was, if I saw my oncologist, then I saw 6 months later my breast surgeon. But initially, I would see both of them for many years, until the breast surgeon eventually said to me, as long as you have somebody doing a breast exam for you, you're fine, kind of thing. And not kind of thing, but you'd be protected. But in the meantime, obviously, I had an annual mammogram and sonogram. And in my first breast cancer, even though I felt something, the tumor did not show up on the mammogram, but on the sonogram. So I was always getting, and some women don't have that, I say, privilege. One would think everyone should have a mammogram, sonogram, but so I was getting that annually, and then they added in annual breast MRI. As I think I had touched on, that my breast surgeon didn't really think that was so necessary to do it annually, but in this most recent diagnosis, it was on the. I had the breast MRI, and the report came back that there was something suspicious, a 2 to 10% level of suspicion. And I was like, what could that be? But the report sort of, I don't know if there were two people or one person said, revisit in 6 months, have her come back and repeat the MRI. But then someone else, and it may have been the same person, said, you know, she should have a biopsy a breast MRI guided biopsy. So I have had
Mm,
that before with another. It was a scare more than anything. And basically, they're doing the breast MRI, but they're doing a biopsy, but they're using the breast MRI to guide them because it's all the way in. It's not palpable. And clearly it wasn't visual because we're talking about cells. So what happened was the radiologist called me several days later and she said, "You have DCIS and you need a mastectomy." And now there is some debate and controversy. Well, you could just have a lumpectomy. You didn't need necessarily to have a mastectomy. There's also a movement of people, women, who believe, why do I have to be mutilated that way? Why can't we just watch and see? Now, that's fine for some people, not for me. I have a strong
mhm.
family history, I have a personal history, and I have genetic markers. So for me and my breast surgeon, who was someone I had seen 26 years ago, but she was pregnant, so she didn't do my surgery, but I was referred back to her. Small world, right? She was
Mm,
like, I completely agree with you. You should have a mastectomy. So that's what I did, and I opted for the reconstruction with an implant. And I'm in the middle of that process, obviously. I say obviously, I had to learn this too. I'm being filled and pumped while the skin is being expanded underneath the tissue, and eventually the plastic surgeon and I, although he's the perfectionist, will come to the decision we're happy with everything the way it is, and then they go back into the OR and they place a permanent implant in.
mhm.
So, so what happened was mammogram, sonogram, and then breast MRIs were annual. And as you know, with a breast MRI, of course, you can have things light up that are false positives. Also, around the time of COVID, those vaccines were prone to, I don't even know what the word is, but highlight an area that really was okay, but it looked like something. So, you know,
I
it's a
remember that.
risk.
Yeah.
Yeah, yeah. So, but thank God for MRIs, right? I mean, in
Yeah,
my
and some
case,
due
anyhow.
diligence. Yeah, absolutely. And for due diligence and nobody dismissing it, you definitely had to do your fair share of follow up and follow through. But thank goodness you were getting the additional screenings that you needed to be able to detect it. And then also, even though you had had another false positive, still going forward and, following through with this. And I think you touched on something that's really important is that the individualized care, right? Taking into account all of your risk factors, what it was that you wanted and how you wanted to proceed, and coming to an agreement with your surgeon on what was going to be the best thing for you, but also give you the most peace of mind. And such a critical piece of the conversation to be able to have those conversations, understand what's happening so you can have those conversations with your breast surgeon. And I know that you have, a I was going to say a particular feeling about breast surgeons and that more people should have access to them. And when you said that to me earlier before we started recording, I thought, of course, they should almost be part of our routine care team, much like an OBGYN would be. Even though we're not pregnant, we see them for our well woman care. And why not have a breast surgeon as part of our standardized care team? And so I wondered if you could share a little bit more about that and what that
Yeah.
relationship meant to you.
Well, when the first time around, and I said I did feel something, and it was sadly around the time my mother was declining and dying. I knew that I was going to go see an internist because at the time, I guess I was in between having a regular internist. Went to see someone. He blew it off, kind of thing. I saw my OBGYN, and she was smart enough to know that she couldn't really, not figure out, but you know, she knew she needed further guidance for me, and she sent me to a breast surgeon. And I actually said this to the breast surgeon recently. I said, I think every woman should be seen by a breast surgeon because we know that OBGYNs or gynecologists, because eventually you do leave the OBG when you're not having kids anymore, they know the bottom. They don't really know the top. I mean, yes, they went to medical school, but the breast surgeon confirmed for me that you have to get a special certification as a breast surgeon in breasts. So either they should make OBGs or gynecologists also get that certification, or every woman should see a breast surgeon because they have that knowledge, that experience, and I think it's worth doing. I know as women get very nervous before their mammogram and sonogram, and I know so many women who've, luckily for them, they've never had any breast cancer or or scares, but they're so petrified to go. And I understand because it's a scary experience. It's very uncomfortable. You do a lot of waiting around in a waiting room, often half naked. You have a robe on, but and it's not a very pleasant experience overall. And sometimes you encounter nice nurses and staff, and sometimes you don't. And I always like to say, "Gee, I wish that would change too." I'm not in there for
Hmm.
a mani pedi and a facial. I'm going in there for something very serious to make sure I'm fine. So I just think that every woman should see a breast surgeon. I mean, sorry, I was rambling a little bit, but
No, no, I really, I love your take on that. And I think you talk about something really important, and that is the fear that a lot of women do face in kind of postponing some of those appointments that they know in the back of their mind that they should, but they put it off. And you're speaking from experience, having watched your mother die of this disease, having your own diagnosis shortly thereafter. And I can imagine what that was like for you. What advice do you have for how to do that?
yeah, it wasn't really routine because I felt something, and eventually the breast surgeon did a biopsy, and she called me, and I to this day I remember getting that phone call. You have breast cancer, and I was in my office, and I remember I had a pen or pencil, and I just threw it across. I was so angry, and of course scared. I had a my son at the time was 2, and and the thing that's strange to describe, but I adored my mother, and her passing was more difficult for me and grieving her than even my own diagnosis. And maybe because I had a small child at home, I just focused on what I had to do. And, you just sort of go through the motions, right? I mean, you don't have much choice. It was hard. I'm not going to tell you, before my mother passed, I remember going to work every day and I'd cry myself, on the way to work, I'd be crying. And, because I knew what was happening, obviously. I was going to lose my mom. And then, when I got my diagnosis, I was still so hyper focused on missing her. She was the woman I spoke to every day of my life. And, it's a big loss. It's just a hard thing to handle. So, I just went about my business, and I always wanted a second child. So that was also a goal for myself that, they put me on tamoxifen, which is standard of care after chemotherapy, and it's for 5 years. I kept asking my breast oncologist and the surgeon, like, gee, should I stop? Can I interrupt my tamoxifen? And you can get all kinds of responses, but that was my dream, to have another child. So I guess that also is what kept me going. And I am happy to say that I do have a second child. There's a very big age difference. My younger son, Alistair, is 19, and my older son just turned 28. So I sometimes can't even do the math myself. I was on tamoxifen for 5 years. I then pretty much, oh, because he was 2. That's right. He was 2. He was probably 2.5 when I finished. Then I was on tamoxifen. And then within a few 6 months or so, I tried to conceive. And then eventually, there's like an 8.5 year difference between carrying, being pregnant. And so that was, something that I wanted. I wanted to have another child, and thankfully it worked out.
Yeah, yeah, thankfully. Um, Okay, so you are right in the middle of treatment again, right? You mentioned that you have expanders in. I just still can't believe that like I get to sit down with you. I know what that post-surgical feeling is, having gone through that process myself, and really admire your willingness to be here with me today and sharing this. And wanted to ask a little bit more about your journey from patient to advocate to public advocate now. What sort of drew you or compels you now to speak more publicly about your experience?
So it's a couple of things. I mentioned I work in healthcare communications, and oncology has always been a big part of the work that I'm involved in. So I know about breast and lung and kidney and all these different um, cancers. And wherever I go, and I've been to many medical meetings, ASCO is the big annual oncology meeting. There's AACR, which is the annual early cancer research. There's ESMO, which is the European meeting. San Antonio Breast, which is obviously the breast meeting, which is very well attended, obviously, by breast oncologists. It's become quite a large group of people. And whenever I went to those meetings, I was representing clients, but I always went in with two hats: Nancie, the PR professional, and Nancie, the cancer patient. And so I saw the whole excitement of a medical meeting when there's, the watershed moments of, doctors putting up. This actually happened when I went to one for Pfizer, and their lung cancer treatment was in development. It's now called Xalkori. It was crizotinib. It was so exciting when the doctor from Mass General put up the figures, and I saw the impact it would have on patients and families and caregivers. I was also working with cancer patient advocates, and I got to know several of them, and I knew what they were doing was helpful to other people. And I became very close to one gentleman who was he was on the clinical trials and he was taking the medicine. That particular medicine targets a genetic mutation called the ALK mutation, and it definitely extended lives. And this was a big movement around genetic testing and how lung cancer, very often non-smokers, lung cancer, they get it and then they find out they have this genetic mutation. Then others were identified, other drugs came about. All this to say, it is so rewarding to be in that environment. And a year ago, a gentleman I knew from another world, I found out he had CML, which is what I have. And he was talking about it, and he has a podcast, and he just had his fourth conference. He does a patient perspectives conference. And I went and walked into the room, and it wasn't a huge crowd, but the people that were speaking were patients, and they were sharing their stories. And I had an epiphany: I could do this, I could help others. And I come
Mm.
from not only being a patient but being a PR professional, and that was sort of the impetus to do it. And then this year, this past October, which is when he holds them, he invited me to be on the CML panel. So there
Wow.
I sat with, he was the moderator, and there were three of us. And came to know the other people that had CML. One has done incredibly well, so she's not even on medication. But like, it was really wonderful to sit there and talk about it and share our experience. So that's how it all started.
Love that you recognized how much other people's stories were impacting you and those around you, being able to sort of have like a front row seat to the impact that sharing your experience has, and having that be what inspired you to want to share more intimately about your story, even though you were already very much an advocate in the space and well informed in the space. But for you to open up on that level was definitely a new arena for you. And wow, What a journey. I really appreciate that. And I feel really, really, like I said, really lucky to have you
Thank
here
you.
sharing that with us today. I'm curious what you would say to somebody who's looking for connection, maybe just other people to talk to. You know, sometimes you feel really alone when you get a diagnosis like this and you're not quite even sure where to start finding people that you could talk to that might understand what you're going through.
Yeah, so that's a very good question. Well, we know there's lots of organizations, and it seems like there's more every day that are either starting up or you hear about it, and you have to find where you feel comfortable and what makes you feel better about the situation. And in the same breath, it doesn't necessarily have to be a group. I mean, maybe it's your therapist, maybe it's your religious organization that you're affiliated with. There's finding someone that you can talk to that you feel listens and understands. One of the hardest things is, when you share with friends, very often you get questions that can feel invasive, that can sometimes feel like, are they evaluating how bad off I'm doing? Or, you know, they
Mm.
mean well, but I think that's another reason why maybe I was private for so long, because sometimes the questions can be off-putting.
Mm-hmm.
Um,
Mm-hmm.
I mean, even, with this recent diagnosis, when I would tell people, oh, so are you going to get chemo and radiation or chemo or and I was like, actually, no, thank God I don't. But I don't know. I sometimes feel like, shouldn't I be the one sharing that rather than being asked? Um,
Yeah. And
I
I
don't
know
know.
that it can be well intentioned, but it does sometimes just feel also exhausting to have to
Yes.
explain it all again and dig into it again and yeah, and
Yeah.
all the whys, and sometimes you're like, I'm just trying to get through the day. I can't I can't take on your curiosity right now, even though, you want to be helpful. It's just sometimes more than
Yeah.
you have in the tank to deal with. I get that. Yeah. So tell me a little about the work you're doing now in the advocacy space and how you're looking to share, the work that you're doing now.
Yes. So I joined a few organizations. I think the one we met, Women Health Advocates, also has a early detection breast cancer. I always get the name wrong. Or early detection.
The
No,
Breast Cancer Early Detection Coalition, I think.
that's it. That's it.
Yeah.
Um, and I joined that group as well, and I'm very excited because they have a Capitol Hill Day in the spring, and I'm planning to go. And as they have done in the past, there was one in December I had hoped to attend, but it was right before my surgery, so I decided to wait till the warmer weather. And I'm excited to have this opportunity to share my story in that forum. Um, I am active on LinkedIn, and I love supporting other people who are doing things in the advocacy world that can benefit others. So, yourself, you post about people's interviews and your podcast, and I'm happy to share it and to comment to essentially bring more eyeballs in. So, um, and by doing podcasts like this, I feel like I'm helping contribute to the information out there for patients.
Yeah. Absolutely, absolutely. Is there anything else you would like to share with listeners before we wrap up this interview?
Yeah, the power of positivity and mindset, and looking for the joy and happiness wherever you can find it. Now, I don't mean to sound like, oh, Pollyanna, but we all have good days and bad days in general. And I know I still do, meaning one day I'm frustrated, this person didn't get back to me, or that opportunity fell through, and I'm annoyed and frustrated, and oh, this is awful. But then the next day you wake up, it's a brand new day, and guess what? Things start, the next day things are better for you. And you could equate that even to your patient experience. Like some days you're going to feel, and I don't mean physically, I mean even emotionally or physically, I guess. yes, when I came home and I was recuperating, don't think I expected it to be as. I have a very high tolerance of pain, but I don't think I expected it to be or take as long with the pain. And you know, some days are better than others. So maybe that's the day you stay in bed and, you know, don't be so hard on yourself. And, you know, it's a scary time when you're diagnosed and you have all these appointments you have to keep and you have to go for the treatments. Yeah, it's a very uncertain time, but try and surround yourself with people and things that make you happy. I happen to love theater, so going to theater. I happen to like, I shouldn't say it out loud, shopping. If that's what brings me some joy, always went for my weekly manicure, my monthly pedicure, whatever it is that makes you happy and joyful, you have to do it,
Hmm.
and do it for yourself because, you know, people aren't always going to be the ones that are going to make you happy. It has to come from you, you know? That's what I would
Yeah.
say.
I love that. Thank you. And I hope to see you on the Capitol steps in the spring. I think I went with the Breast Cancer Early Detection Coalition last year, and it was so good just to have all those people together for the same cause doing the work. And it was a really, really wonderful time and really powerful. And it felt like being there, sharing our stories actually really does matter and make a difference. And so I say that because sometimes it feels like, is any of this doing any good? Are we reaching anybody? It can be a little bit exhausting sometimes, wondering if you're making a difference at all. And I definitely felt that there. I felt a great deal of hope and mattering and care and passion for the work that we're doing. And so it was really good to be part of that. And of course, all the people that we got to meet during that. And so I look forward to being able to see you there in person. And I really hope that that works out for both of us. Because I think
Me
it matters, and it's a good time. It's a wonderful group of people as well.
Indeed. Yeah. And it's growing. That's even better
Yeah,
news. More and more people are joining, interested in these issues and making a
yeah,
difference.
yeah, absolutely. Yeah, you don't have to just be a survivor. It's caregivers, it's family members, it's anybody that cares about this. So they all have a reason why they care, and so it's fun to hear all the different experiences people have and what brought them to this place and wanting to support. So um, yeah, thank you. I'm really grateful to have you here. Grateful for you being willing to share your story and your wisdom and your courage and your joy. You've been through it. And so I think that what you're able to share with us today is really going to be beneficial. And grateful to our listeners for listening all the way through here with us. And if you have any questions, reach out, send us a message, and let us know what you took away today. We'd be happy to hear from you.
And thank you for the opportunity. I appreciate it.
Yes, absolutely, Nancie. We will stay tuned. We'll get all your contact information. We'll leave that in the show notes, a little bit more about your work and where people can find you. I think on LinkedIn and maybe Facebook. Um, and follow the Clear Pathways program, Women's Health Advocates, and the Early Breast Cancer Coalition. We'll leave all those links in the show notes.